The United States of America has a GDP of $19.39 trillion, making it the world's most economically prosperous country. So why is it the only first world country that doesn't have universal health care?
From my perspective and also from my opinion, I think that we have a very lofty healthcare system right now. It's very expensive. It is not sustainable.
In early America, medicine was facilitated by private doctors and healers. But as the Industrial Revolution forced more and more people into cities, state-run hospitals, homes for the mentally ill, and publicly funded treatment for diseases began to sprout up. With the onset of the Great Depression in 1929, many European countries turned to a system of universal health care. Initially, it looked like America was heading in this direction as well, as the AMA and leaders of the Progressive Era began to advocate government-funded health insurance. However, Roosevelt was not able to take the political risk of national health reform. In the absence of government-funded health care, private insurance companies and their forerunners attempted to satisfy the need for affordable medical care. However, it was not until 30 years later, in 1965, that the federal government made its first attempt at providing health care to groups that were historically barred from private health care insurance. Under the Social Security Act passed under Roosevelt's administration, President Johnson signed Medicare and Medicaid respectively, a health insurance program ensuring people over the age of 65 and of low income. The next American attempt at health care was the Affordable Care Act, signed into law by President Obama in 2010. The effect of Obamacare has been monumental. Only 11.3% of Americans are uninsured, compared to 16.4% the previous year. Additionally, the ACA was especially effective among minorities, such as the Hispanic and African American population, with the uninsured rate dropping 9.7% and 7.8% respectively.
It is commonly known as Obamacare. They're synonymous, same thing. And it was created to insure millions of Americans. So it was kind of the first step to universal coverage in the United States.
Although Obamacare was a step towards universal health care, in 2018, President Trump repealed the mandate in which uninsured people would be penalized. Instead, Trump is currently working on the American Health Care Act, which would bring cuts to Medicaid, a social program ensuring low-income people.
Congress passed Affordable Health Care Act, which would also help mandate that individuals would get health care. Everyone, and if you did not get your health care, that there would be you would be penalized.
Trump's vision for healthcare policy would cause the uninsured rate to rise, possibly higher than before, due to the considerable rise in healthcare rates since the act was passed in 2010.
The drug industry charges what people are willing to pay, and unfortunately, America seems to have more money than the rest of the world, and money's always been a motivating factor, and I think that's why we're coming up with a lot more, drugs, a lot more solutions, a lot more inventions than other countries.
As a result, this could lead to the death of more Americans than ever before. Around 45,000 Americans die each year due to the lack of health insurance. This is around 1.7% of all deaths in America. And the true tragedy is that these deaths are all a result of diseases and ailments that modern medicine can cure. Though access to healthcare is a significant issue, donating to nonprofit organizations that provide comprehensive healthcare to those in need, such as Gardner Health Services, will make a difference.
If people that are wealthy could donate to clinics like ours, if one of our patients needs, some kind of a procedure and they can't afford it, then we can send them directly there.
Ultimately, access to healthcare is a human issue affecting thousands of Americans.
So it's really, our mission is to help the poor. Our goal is, healthcare is not the end, healthcare is a means. It's to try to keep them healthy so that they can follow their dreams.
It is vital that the medical industry, as well as people and the government, understand that healthcare is a right, not a privilege.